Sawadee and good afternoon. Welcome to the English language summary of the daily press briefing live from the Center for COVID-19 Situation Administration, or the CCSA. For today, Wednesday, the 12th of May, 2021, allow me to summarize what Dr. Pisamai just kindly informed us during her briefing just now. So we'll start with the general situation and the new number of confirmed cases today. We have new confirmed cases standing at 1,983 cases. And this leaves us at an accumulated number of confirmed cases standing at 88,907 cases. We have today a new number of recoveries, new recoveries, standing at 2,006. So that's a good, at least it's good news that we have more new recoveries than new confirmed cases. So that leaves us for the new total recoveries, accumulated recoveries, standing at 59,043 cases. And sadly today I have to report to you that we have now reached a new high in the number of fatalities. Today we've reached a number of 34 new fatalities. Most of the fatalities today are patients with high blood pressure and diabetes and high cholesterol. There are 12 cases, or about 1/3 of the cases that have contracted the virus from family members. And this continues to be the risk of new infections. And Dr. Apisamai right now just also summarized that the most highest risk factors to that eventually leads to some most undesired deaths. The highest risk factors still remain about people who are elderly, so age is a high risk factor. People who are over 60 tend to contract and have more severe symptoms, and also those with underlying medical conditions or chronic diseases. So these are the factors that we have to be very careful about. And so if anyone who knows that they have such risk factors, they should be even more vigilant. And if you have any symptoms at all, you must immediately inform medical authorities and have these symptoms checked out. Furthermore, we have today, Dr. Apisamai also mentioned that due to rigorous testing and active case findings, we have seen some some improvements in provinces outside, in other parts of the country outside of Bangkok. So there are now 18 provinces which have 0 new infections, and mostly these provinces are in the northern part of Thailand. And we have now 38 provinces that have less than 10 confirmed cases. So it appears that around the country we have some new improvements in the situation of COVID infections. And also, for some more observations for the new cases found today, there are 75% of the new cases that we found are still clustered around in Bangkok and nearby provinces. So this again is a result of our active case findings. So it's been able to enable us to find new infections as soon as possible. And because of the current situation of these number of confirmed cases, we have now 1/3 of the accumulated patients treated in field hospitals The rest are treated in hospitals, in medical hospitals. And as of today, the total number of patients with severe symptoms has increased slightly and already exceeded 1,200 people. And out of this number, 401 are on ventilators. But nonetheless, we can confirm that the existing medical facilities that we have are still manageable and still able to accommodate patients, both with mild and severe symptoms. And the government is continuing to prepare to open a new field hospital in Busarakam Hospital at Challenger Hall in Muang Thong Thani on the 14th of May 2021, which could primarily accommodate 1,200 patients, including those with moderate symptoms. So we are doing our best to accommodate the increased number of infections. And we are also getting help from the private sector, assisting us with medical facilities and equipment that are necessary to treat patients, and they are also extending our abilities to ensure that patients can recover as soon as possible. Also, the government is trying to conduct active case findings as extensively as possible, and including among migrant workers who are actually entitled to social welfare programs from Thailand. And they will be able to get tested at the Bangkok Youth Center in Dindang district. And should we find cases that are infections, new infections, these migrant workers who are infected are entitled to treatment as well. As Dr. Apisamay mentioned, it doesn't matter, regardless of their status, whether they're here legally or not, they will be treated. So that's one thing that we need to stress. Legal status is not an issue at all. Priority is to get them treated and recovered as soon as possible, and we will deal with their legal status later on. So, furthermore, on the current status of vaccinations to date, since the 28th of February until the 10th of May 2021, we have administered 1.89 million doses of vaccines. And within that number, 530,000 people have received both doses, while 1.36 million people have received their first dose already. And at the moment, the CCSA is expediting vaccinations in communities around Bangkok that have high risk of virus transmissions. And these include, for instance, communities that have already been mentioned in earlier reports, such as Bon Kai, Klong Tei, Dindang. The authorities are also right now considering prioritizing vaccines to administer vaccines to these high-risk groups. These are the people in services industries or those who are constantly in contact with the public, such as teachers, taxi drivers, public transport workers, and restaurant staff, for instance. And we hope that when we administer targeted vaccination prioritization, we hope that we can help speed up our reduced risk of increased new patients and the risk of patients with severe symptoms. We hope that doing this will help reduce this risk. So before I finish my briefing today, allow me to also reiterate what Dr. Apisamay just said. We want to observe that our friends who are currently now observing Ramadan, our Muslim friends in Thailand, they tomorrow will be celebrating Eid al-Fitr, which is an important occasion that marks the end of Ramadan. And due to this current situation, the Department of Disease Control recommends that Eid al-Fitr prayers be performed within their households or within the family units instead of going to the mosque. And this is to avoid large gatherings of crowds. However, if it is necessary, if you do so wish that you need to go to the mosque for this very important religious observations of risk this important ceremony, please wear your masks and use personal praying mats and try to keep your physical distance. So that's all I have for you today. I hope that we all stay safe and continue to stay at home, work from home, so that we can help reduce the risk of new infections and don't burden our medical personnel and doctors. Thank you for your kind attention. ขอบคุณค่ะ สวัสดีค่ะ